Hello, everybody. Welcome to another IG Live here in My Sex Bio. I'm very excited about our conversation today. We're talking today with Kim Vopni. She's also known as the Vagina Coach.
Hello.
Hey, hello, how are you?
Awesome. Thank you. Thanks for having me.
Thank you. Thank you for joining us today. I have a couple questions here. Just reminding folks that we're talking today with Kim Vopni. She's also known as a Vagina Coach. She is an author, speaker, pelvic health coach, and she's also president of Pelvienne Wellness Incorporated. So we're going to be talking today a little bit about, well, what you work on and a little bit also, if possible, about sexual aftercare. So one of the questions that I have here to ask you is how can pelvic health affect your sexual experiences in general terms?
Yeah. I'll start by maybe just talking quickly about what the pelvic floor is and then how it can contribute to either pleasure or not and kind of function during sex. But the pelvic floor is a group of muscles that closes off the base of our pelvis. So whether you have female or male anatomy, you have a pelvis, which is formed of bones. So we have our hip bones, and then we have our sacrum, which is a triangular bone. And at the end of that would be the tailbone. So that's kind of a continuation of our spine. And those three bones, the coccyx technically is another bone, but for the most part, three bones are joined together by, there's two joints in the back with the SI joint. There's a pubic joint in the front. And then the pubic joint, the two sit bones, and the tailbone form kind of like a diamond shape where those pelvic floor muscles attach to and close off the outlet to our pelvis, so to speak. And there's layers. It's multiple muscles. It's not just one muscle. The first two layers are primarily for helping with our openings. So closing the openings, but also allowing other openings to be able to open freely. And the third layer is primarily responsible for organ support. So in the female body, we have the bladder, the uterus, and the rectum. So the pelvic floor plays a role in those two functions. It also plays a role in our pelvic and spinal control and stability. It works in relationship with the diaphragm. So there's a bit of a sump pump action that helps kind of move lymph and stuff through our body. And then it's also hugely involved in our sexual response. And like any muscle in the body, we can have sometimes overactivity where we have tightness or restriction or tension in that group of muscles. And we can also have the flip side where we may have lack of tone, we may have some atrophy, we may have some laxity. And both of those could potentially interfere with our capacity to experience all that sex can offer. And not just penetrative sex, any sort of touch or pleasure. Sometimes there can be pain associated, especially in the muscles that may have more tension than normal or may have kind of overactivity in them. There's also different pain syndromes that may influence the tissues or even the vulva, even the entrance to the vagina. So not always directly associated with the pelvic floor muscles themselves, but the muscles have a huge role in our capacity to accommodate fingers, toys, penises, to experience orgasm or not, to experience pleasure or not. So it's a really vital part of the body.
I don't know if you have any answer to maybe if pelvic health can also impact your perception of sex in itself. Like what kind of psychological impact can this have in people and their perception of sex?
Work that I do. So I primarily work with people who are experiencing some sort of challenge. The two most common would be incontinence and organ prolapse. So incontinence is where gas, stool, or urine come out of the body when you don't want it to. So it leaks out for some reason, and that could be nerve damage. It could be inability to control the muscles from a timing perspective. It could be muscles that can't contract strongly enough to prevent the leaks from happening. And then there's organ prolapse, which is where the bladder, uterus, and or rectum can start to shift out of their optimal position and create bulges into the vagina. And so with incontinence, any form of pelvic floor dysfunction, I'll keep pain over here just because there's kind of some other considerations. But with regards to incontinence and prolapse in particular, if you are preoccupied, if you're worried about leaking urine or gas or stool, or if you are worried that your partner, if you have one, may feel or see or smell something, that will interfere with your ability, your involvement in the moment, your presence, basically your present mindedness. I don't think that's a term, but it is now. So it absolutely, if we are not confident, if we are afraid, if maybe there's been some trauma in our past, or maybe there's been trauma associated with childbirth, which contributed to the development of the pelvic floor dysfunction, all of that can interfere with sensation, capacity for pleasure, capacity for allowing something to come into the body if that's part of your sexual routine or you want it to be. So it's the mind is hugely incorporated, interrelated, interwoven into our pelvic health. And even when I'm working with people and helping them overcome incontinence, help them overcome prolapse. I'm not a sexual wellness counselor, but the conversation of sex definitely comes up. And when we can optimize the function of the pelvic floor, their confidence can build, their capacity for pleasure and enjoyment can return. Sometimes they're able to have sex again. Sometimes they have either been avoiding it or they haven't been able to participate. And when you can give that back to somebody, it's life-changing. And then just quickly on the pain side, pain can be, as I mentioned, muscles that have too much tension. Pain can be from trauma. Pain could be from scar tissue from a surgery or childbirth. Pain can be, it could sometimes be there for no reason. Sometimes people can have pain in their bladder. Sometimes they can have pain in the tissues from vaginal dryness even. So pain has a whole bunch of different things. Sometimes it can be pain even in the joints. And that is also, for the most part, depending on the contributing factors, very treatable. And again, can be incredibly life-changing. When you can take away the pain and allow somebody to experience pleasure again, it's profound. It's incredibly profound.
How is it that we're not providing this information ahead to people
Yeah,
before
yeah.
they make the decision?
We have such an opportunity during pregnancy to introduce the conversation around pelvic health. I believe way earlier than that, but if you're going to do it at some point, then pregnancy is great. So in pregnancy, we have the weight of the growing baby, potentially babies. We have hormones that are influencing the connective tissue and the joints in our pelvis, and we have an ever increasing load that group of muscles is carrying. We have our belly growing out in front of us, so we have a shifting center of gravity. So all of those contribute to posture changes, breathing changes, potential, like the postural changes can contribute to different compensation strategies for core control. And so all of that is just in pregnancy. And then we have a birth. It could be a vaginal birth. It could be a cesarean birth. And many people think that when they have a cesarean birth, then they are immune to pelvic floor challenges because they didn't give birth vaginally. But they've still carried the weight of the baby. They've still had all the hormonal changes. They've still had the adaptations to all their posture. And sometimes some people have even pushed for a bit and then gone to a cesarean. But even if they had a scheduled cesarean, cesareans are multiple layers of incisions through the abdominal wall down into the uterus. And then there's resulting layers of adhesions as they sew all of those layers back up. And that can be sometimes even to more core function challenges afterwards. So the principles of pelvic health and pelvic floor retraining after pregnancy and birth are the same regardless of the way you've given birth. So arguably cesarean births can contribute sometimes to more core control challenges afterwards. So I always say that we should be preparing for our recovery while we're still pregnant. And we have to make sure that our recovery is very intentional, very diligent, and using pelvic floor initiated movement to help, circulation, blood flow, healing, nerve growth factor, but also just like muscle memory to kind of remind the pelvic floor how important it is, but also all of the different jobs that it's responsible for. And then from a menopause perspective, once we hit menopause or as we're approaching menopause, we have all sorts of hormonal fluctuations. And after we give birth, we have lower dropping estrogen, which can sometimes contribute to vaginal dryness, and then they'll start to level out. And then as we're approaching menopause, we can start to experience some of those same hormonal fluctuations, and vaginal dryness is a big one. Vaginal dryness can contribute to pain with sex. It can increase your chances of having UTIs or frequent UTIs. And it can also contribute to irritation and discomfort. But if we know ahead of time that pretty much all women are going to go through, every single woman will go through menopause. We know that. The majority of them do experience vaginal dryness. So if we knew that ahead of time and were given tools such as moisturize your vagina with hyaluronic acid, see your pelvic floor physio to keep your pelvic floor muscles optimized so that there's good blood flow, good circulation, good movement of the muscle,
Totally.
then wouldn't that be life-changing? Rather than so many people suffer and they don't think, they're either dismissed dismissed by care providers. They don't even know that help exists, so they just kind of, put a pad in, or they just accept that sex can't be pleasurable, so they avoid it. And there needs to be so much more information provided to women, and ideally well ahead of actually reaching menopause.
What toys can you use for Kegels?
That's a good question. So there are tons of different pelvic floor exercisers on the market. The most common, if anybody's on Instagram regularly, you will have seen PeriFit and the LV. PeriFit seems to be the one that's most marketed, and that's the one that I typically get asked about the most. There's also Kegel balls, Kegel weights. There's devices that have like electrical signals. There's all sorts of different ones. My advice on those, I'll get to the different types in a second, but before you invest in any sort of pelvic floor device, I recommend you first invest in a pelvic floor physical therapist. And not everybody in the world has access. If you live in a rural area, you may not have one, but if you can drive even an hour or two away and see a pelvic floor physio at least once to have an internal evaluation and assessment of your pelvic floor, you will walk away with an understanding and an appreciation and a knowledge about your body that you'll wonder, how the heck I didn't know this. I've been living in my body for 30 years, 40 years, 50, however old you are. So that person can help identify whether your muscles maybe hold on to more tension or maybe they are more lax. And if you were one who held on to more tension, similarly to when I said if you do more Kegels, the interpretation of Kegels is contract and hold. If you do more of that type of a Kegel exercise, you could not experience any benefit, really. So it's a good idea to have an understanding of what your pelvic floor would benefit from. And if it is a Kegel device, then you can go and buy something that will help support your training. So in terms of the devices that I recommend, I do like the PeriFit. I do like the LV. They have a biofeedback component that allows the user to interact. So it hooks up with an app on your phone, and it gives you kind of like video games for your pelvic floor. So you can kind of it asks you to jump over mushrooms or catch the birds in the sky. So you have to contract your muscles in a way that allows you to, kind of like Space Invaders, or that ages me. You use your pelvic floor muscles. Now, what it doesn't necessarily do, the LV can to some extent distinguish between people who are doing a proper contract, lift, and let go. So a Kegel exercise is a closure and a lift and a let go. Most people interpret a Kegel as just a squeeze, and sometimes they will use their inner thighs or they'll use their glute muscles, or they may hold their breath and bear down. And sometimes those all create pressure that can register on that app and give the illusion that you're doing your pelvic floor exercise. The LV can distinguish between people who are bearing down and people who are actually doing a proper Kegel. So if you're going to start somewhere, I would say the LV. And then I like PeriFit. The weights, so jade eggs, yoni eggs, Kegel weights. I'm partial to the Kegel weights that are silicone based. They are way less likely to introduce any bacteria or contribute to any forms of infection. The stones and what have you can be porous and can pose challenges for some people. They are weighted. So the idea is when just like we go to the gym and we lift a weight to build muscle, strength, endurance, and hypertrophy, we can do the same thing in our pelvic floor. You have to have muscles that can hold a weight to start out with. And the other thing to consider is I'm not a big fan of putting them in for hours and caring about your day. I think put them in for, say, a 10-minute practice, or do a practice where you put one in and you do some contract and lift and let goes, and then you take it out again. There's the Kegel bell is one that I like, where it actually has the weight outside of the body and it moves a little, so it has a little bit of dynamic. It asks your muscles to respond to dynamic movement. Secret Whispers also has a set that I like. Intimate Rose has a set of Kegel weights that I like. So those would be the brands that I'm most comfortable referring. So those would be the main ones, I would say. Those are the main exercisers.